We are at our X-ray station. We have digital X-ray here, and this is great because it does a lot of things for us as well as our patients. Number one, first and foremost, is it allows us to get great quality X-rays with using less radiation. So that's a safety component, number one, for our patients that we're proud of. Number two is we get better pictures than we used to with the old film and developing technology. And if we do have to take any retakes, we can see the film right here, so we can see the images right here. We don't have to develop film, and so it's a less the waiting period is less longer for the patient. They can get in and get out much faster than they used to be able to. We can manipulate the image in a variety of ways, and so the image, the quality is much greater. These X-ray units are pretty expensive, and so there's only a handful of clinics around town that incorporate digital X-ray. I have an image up here of the spine and the neck, which is called the cervical spine of a patient, and this spine has a lot of findings in it, a lot of findings which are not so great for the patient. There's a lot of degenerative arthritis. There's a narrowing and decrease in the spaces between the bones, which means there's degeneration of the discs, the cartilage discs that are between the bones. There's a lot of changing in shape of the bones, which means there's some pressure on the bones over a long period of time. Also importantly is there's a change in shape of the normal curve, of the normal posture of the spine. Now typically we want to see a curve in the spine that curves forward. That would go kind of like this. And this is one of the cool things that digital X-ray allows us to do. Just that little thing right there. So normally there would be a forward curve. This is the front of the body. This is the back. This is the back of the head. We normally want to see a curve curving forward. That means there's good alignment of the spine. There's good function of the joints. There's good movement. There's good pressures on the discs. That meaning that there's not abnormal pressures on the disc. So if I want to make a drawing of a line of how this spine is actually going, and we can compare the two. Well, the spine here goes like this. So we can see there's a vast difference between the two here. There's a vast difference between the posture here of what's good and normal, what we want to see, and what's abnormal. Now there's going to be problems with this spine. There's going to be symptoms associated with this: neck pain, stiffness, decreased range of motion. We may have some pressure and tractioning on the nerves coming off the spine. That could result in pain or numbness or tingling or weakness down the arms and into the hands. We could also, this could also be associated with headaches as well as some other problems. The changes in shape of the spine and the severity of the differences can also give us a really good picture and idea of how long treatment will take to get this person better. So that is the significance that we look at for the X-rays, as well as looking for broken bones and disease processes, which are obviously, those are a lot less common. These are more the common types of things that we will see in practice on a day-to-day basis.